Welcome to iSpa Talk, where we educate, empower, and encourage women to practice safe beauty habits, starting with their eyes and skin. I help you connect the dots between beauty and science. Some say your eyes and skin say more about you before you open your mouth. My name is Dr. Janelle O.D. I'm your host and the CEO and founder of Brilliant Eyes Vision Center and Premier Dry Eye Spa. Thank you for tuning in. Let's chat. Hey, happy Sunday, my eye squad. I hope everybody's having a good day. Yeah, we have a special guest today, and we're going to talk about something that you guys may not have thought about, or you may have thought about and didn't know what to do. First of all, is anybody else drinking coffee on a Sunday evening? Woo, it's been one of those days.
I just finished the Red Bull, so I'm with you.
But however you get your caffeine, yeah, I woke up from a 3-hour power nap. Yeah, so that's how you know you tired when your power nap turns into almost time to go to bed nap. And so I got my coffee. But first, for those of you who do not know, I'm Dr. Janelle O.D. I am the CEO and founder of Brilliant Eyes Vision Center and Premier Eye Spa. I'm a dry eye specialist, as well as I specialize in optometry aesthetics. And so I am the host, as well as the curator of iSpa Talk, where we help you connect the dots between beauty and science. So it's going to be a fun evening today. We have Miss Alexis Williams with us today, and
Yes.
she is I'm going to let her introduce herself in a moment. But before we do that, I need everybody to go ahead and tag your friends, share this information, go ahead and create a watch party, because this is something you definitely going to want your family members and friends to be able to experience live. But of course, this will be recorded and it will be posted eventually on my YouTube channel. And then in January, we'll be starting a podcast. So you'll be able to catch most of our shows on there as well come January. So we're going to be on every platform for you to get this knowledge. All right. So let's get started today. So Miss Alexis, tell my guests who you are and what inspired you to become a cosmetologist.
Okay, so I'm Alexis. Everybody just calls me Lexi. Let's keep it easy. That's who I am. I'm Alexis Williams. I'm originally from St. Louis. I've been in the beauty industry, the cosmetology industry, since I was 15, 16 years old. It's something that came very natural to me, something that allowed me to connect with other women, with other girls, with whomever was in my immediate circle. And it has been a passion that has been profitable, creative, energetic, transformative. It's been so many things for me. But what truly inspired me to become a cosmetologist or to go to cosmetology school was just, how am I going to get my hair done? And I came out of school right when relaxers and whatnot were still the number one product to be sold on the market and the number one service in African American communities. And I needed to understand what was going on, how it was being done, and how I could be a part of the profitability, if I'm going to be transparent. So that's my story.
And that's a good skill, because I was one of those people who was not skilled in the hair area. And my mother had 2 girls, and quickly she realized this was not her life, not her calling, not her ministry. So ever since 10, I was in the hands of somebody. And so when I went off to college, I was just like, what am I supposed to do? And so luckily, one of my good friends, who I'm still friends with today, I hope she's listening, but she would take care of my hair. She was like you. She was skilled. She wasn't a cosmetologist, but she knew how to do hair. And it'd be funny, she'll come to my room and she'd be like, Janelle, I'm about to do my hair. So if you want your hair done, you need to come on down here. And I grab all my stuff and go down there. And she just made sure that I did not look crazy. And so, Kim, if you listening, girl, I remember, I appreciate it. You kept me not looking crazy during freshman year of college. But today, anybody that's tuning in is probably like, okay, so what does a cosmetologist and optometrist have in common? Well,
Everything.
Everything. And we're going to talk about one topic that is, we have a lot in common. We're going to talk about hair loss and lash loss. So we'll have Lexi go in a little bit further to discuss how she's gone and to even specialize in the field of what she's in cosmetology, to specialize in hair loss. And as an optometrist, I deal a lot with some connections between hair loss and lash loss. And we're going to talk about some things that may cause it, hair loss, and then we'll talk a little bit about lash loss and what are some things that you can do, and we'll have a good time. So tell us about trichology, what made you pursue it, and how did you become headquarter hair clinic?
Okay, so trichology is basically the medical study of hair loss. So it goes deeper beyond like the surface level of cosmetology, which is the science of hair and beauty and nail care and more external visuals and whatnot. And trichology goes a lot more under the surface where we deal with the causes of hair loss. How do you lose your hair? What can be done to replace or restore or rejuvenate lost hair? And, what are some ways that we can even prevent it with our lifestyle choices and changes? I loved being with my clients, and it would break my heart when clients would come in with severe hair loss, or my clients would experience cancer and their chemo treatments, they would have to start all over, or even my clients who would have pregnancies, navigating their hair journey throughout their pregnancy. So I wanted to be able to offer a real life explanation, and I wanted to offer real solutions for my clients at Headquarters Hair Clinic. And our goal there is to create a journey for your hair growth, and that works in a lot of different ways.
Good. So a journey for your hair growth. And so in a personal experience, I had some, some issues with hair loss and, just a little background. I've known Lexi for what? How old is Kennedy? 8. So maybe 9, 10 years.
That's how we judge it. Yes. How old are the children?
Children,
Yes.
yes. And so, I experienced some hair loss after my children.
Hmm.
So after my first son, I experienced some postpartum hair loss, and then it drove me kind of, my edges, everything was just gone. So I cut my hair, everything grew back, and then I had Kennedy, and it seemed like the loss was more severe to the point I went to like. I need to see somebody. I'm just like a dermatologist, like, cause already for my skin, because postpartum was just like really tough on me, far as acne, hormones, hair falling out,
Hmm.
and she asked me if my hair was falling out during my first pregnancy, and she said a lot of times the second time it can be worse, but it looks like we're on the tail end, so we don't have to do any medical intervention. And
Hmm.
coach me through, and I've been able to grow my hair, go natural, cut my hair. I'm still natural, and so what are some things that cause hair loss?
Hair loss can be caused by so many things. It's primarily hormonal. So when you have major hormonal shifts in your body, hormonal declines, that can really have an effect on the production of hair in your body. Stress. Stress is a number one cause of hair loss, and especially women, but especially men as well. How we're managing our bodies, because our stress can elevate our hormones as well. Supplements, diet, our bodies are the reasons why we're experiencing hair loss, in short. So, what's going on with your body will be reflected in your hair. So, the more good things you put into your body, the more care you take of your body, it'll be reflected in your hair care as well. And when you're not aligned with your body medically or health wise, that will become evident in your hair. Vitamin deficiencies, that's a big culprit. Protein absorption. I know in the vegan community that's been an emerging conversation of people transitioning out of eating meat on a regular basis and having a lot of hair loss associated with it. It's a lot of, it's no one thing, but it's a combination of things that have an effect on our scalps and our hair growth.
And so, is there a difference between, hair loss with male and female? We kind of expect by a certain age that a lot of men start to lose their hair.
Hmm.
Is that just mainly from aging and the process of that hair follicle regrowing and regenerating just doesn't happen? Is that separate than, maybe dietary or certain medical conditions someone may have that cause their hair to fall out?
Um, so with men and women, one of the biggest causes of hair loss is androgenic alopecia. That's the main name for it, and that's related with hereditary, again, diet, lifestyle, and mainly testosterone production. That's why we see it quicker and more evident with men than we do with women. But women still produce testosterone as well, and that affects our hair growth as well. Age is a factor, but the beginning stages of hair loss are younger than we think. So we may
Mm-hmm.
start experiencing thinning that we're not aggressive about or that we're not attentive to until it has become a bald spot. And by
Mm-hmm.
that point, we may have lost maybe 5 years worth of time that we could have done something about this, with either like, like I said, our diet, our health, our exercise, things like that. Um, you can't separate androgenetic hair loss from the other reasons for hair loss. They're all a big group of conspiracies, if you
Mm-hmm.
will, where everybody's colluding with one another. So yeah, that's why we have to, when we come into the salon, we do our clinical evaluations of the scalp. We have to go through diet. We have to go through genetics. We have to go through stress level. We have to go through your lifestyle. What are you doing every day? Your maintenance for your hair, things like that, because it's not just one solid factor. It's usually a combination of things, and we have to narrow down between which one is the most aggressive to causing your hair loss.
Yeah, definitely. And then on my end, usually, like you, as you spoke to, one of the connections where you will start to possibly see some hair loss on your head that may transpire in other areas of the body is alopecia, where you have the loss of the
Mhm.
brows and the lash, as well as external factors like chemotherapy, radiation
Mhm.
will cause loss of lash or thinning of lashes, as well as stress. A lot of times with stress, people start to pull their lashes. Stress
Mhm.
will manifest in different ways. So if stress in the body will cause, maybe possibly the hair follicles not to grow as efficiently as they had in the past. But a lot of patients start to, like, for some reason, have like these twitches. They're pulling their uh, so those are things where you can have a combination. So when cosmetologist, we know you're not in the healthcare professional as far as the eye care professional, but are there times where patients will say, "Well, I'm noticing hair loss, experiencing hair loss in other places as well"? And is it just mainly associated with alopecia or some other issues that you've dealt with in the past?
Um, Hair loss can be experienced anywhere. So absolutely on the eyelashes, especially like you said with disorders like trityptolitis. I pray I said that correctly, but it can be experienced anywhere. And usually one of the symptoms that we're experiencing hair loss due to hormonal imbalances is when we're losing it in more of our private regions. So if you're experiencing
Mm,
an excessive growth or lack thereof, or a shift in growth in your um, more of your more personal areas, to keep it family friendly, then that will do it. That'll let you know. And even in the opposite effect, it'll show you a kind of a telltale of what you're experiencing. So, for in the case of women, when they're experiencing excessive growth on their face, that's a sign of a hormonal imbalance that could be essentially robbing them of hair growth in other areas, because that concentration of hormones in one area as a defense mechanism or a lack of physical and hormone alignment will definitely draw away from the supply that you have to reach your scalp as well.
hmm.
Hello?
And so hormones are a big thing, especially with women. I'm gonna give
Mm-hmm.
Betsy, look, she froze a little bit. Let's see if it comes
I'm
back.
back. I'm back. I'm back.
There
Am
we
I
go.
back? Okay.
Hormones play a big role in the also and overall comfort of the eyes as well. You're back, I see. Yeah. And hormone causes the eyes. It does increase the risk for dry disease. And so, unfortunately, a lot of women experience these issues with their eyes as well as their hair based on hormonal changes that we know between our, 40s to early 50s. Let's see. I thought I lost Lexi. Let's see if she comes back. We'll see if she comes back. There she is.
My apologies. Sorry about that. Sorry about that. Okay.
Okay, I think we're both in there again.
Yes,
Okay,
my apologies. I think it
okay,
was me.
good. So yeah, if it goes out, just pop back in.
Okay.
Sometimes my internet does a good. But I was just saying the hormones play a big role in a lot of things with women, as far as their hair causing potential dryness or irritation of her eyes. So with hair loss. specifically talking about if patients
Mhm.
wear a lot of hair extension we have that will increase our chances of hair loss.
I'm sorry, Dr. Janelle. I'm having difficulties over here. So let me run the question back. Were you asking if I was? Would you repeat the question? I'm so sorry. Can you hear me? Am I there?
I sure will. I sure lifestyles that increases our chances for hair loss. So, for instance, patients that may wear a lot of hair extensions or braiding of the hair. Is there anything that increases the chances of hair loss as you continue to age?
Oh, absolutely. Especially for lifestyle changes. Excessive manipulation of the hair will definitely begin to break it down from the outside in. Um, for my extension wearers, prolonged use of extensions can create traction alopecia and it can weaken the hair shaft because the hair isn't receiving the same treatment as the extensions are. So you definitely have to balance your extensions with your maintenance. And it's a lot of different things. Excessive hair coloring services. If you're constantly coloring at the root of your scalp, you could be damaging your follicle, and that won't allow it to grow as well as it used to. There are lots of little things that we can do. Even lack of shampooing and conditioning on the hair, building up excessive, and this can happen a lot of this is when I did my trichology, one of my trichology programs, this was one of the things that they highlighted for the African American community is that when it trying to do trying to recreate hair growth at the scalp, that we need to be able to have access to shampoo and conditioning so that our products will make it past the layers of debris and sebum and just top layers of oils on our scalp. And when that isn't available, we're actually robbing and clogging our pores to the point where it won't produce hair the way that it should. So it's all about creating a lifestyle about where your follicles are free, they're cleansed regularly, they're moisturized externally and internally, and there's balance with our chemical services and styling services.
And so that's a good point that you made too about not being able to properly cleanse and remove debris and keep those oil glands, sebaceous glands open to keep
Hmm.
the hair follicle at the state that it needs. And it's no different with the eye as well. You can
Exactly.
experience some lash loss. Brow loss, not just by external things that you're doing, but when you're not properly cleaning those areas. So, yes, if you're
Right.
not properly cleaning your eyelid margin, lash margin, to make sure that you're removing all those debris, additional buildup of bacteria, not keeping the
Yes.
oil glands open. So the oil glands on the lid are called the meibomian glands. Then you
Hmm.
will start experiencing some lash loss. Your lashes will be thin, they would be brittle, and they will take longer to come back during that lash growth cycle. Um,
Hmm.
and so somebody said, what about sulfate-free products? What is your take on sulfate-free products?
I love sulfate-free products, and sulfate-free products are becoming much more prevalent for textured hair and curly hair and things like that. Sulfate-free products allow the hair to be cleansed without it being immediately stripped. There's a time and a place though for a sulfate shampoo. For instance, when you're doing a cleansing after like going to the beach or going to like the pool where there's going to be chemicals and toxins in the hair, there's gonna, and I'm trying to think of like other reasons, but 9 times out of 10, those shampoos and are needed for professional services. So using a sulfate-free shampoo and conditioner at home is excellent because you're maintaining that scalp. You're getting rid of debris. You're allowing the oil glands to produce properly without stripping and drying your hair out, the strands of your hair out with the cleansing product. So it allows for a better balance for scalp and hair.
And so, Lexi, what I want to do before I move to the next question and the next section, I'm going to see
Okay.
if I can have you pop out and pop back in because you're very grainy and you keep going in and out. And I
Okay.
don't want our listeners to miss out because you're giving us some
Yes.
valuable information. So I'm going to remove you
Yes.
so that you can pop back in. Okay. And so while we're waiting for Lexi to get back in, I do apologize for any technical difficulties. Yes, this is a great topic. It's a great topic for everybody, but especially my sisters. So everything that I talk about, I just making sure that the underserved and underrepresented are being able to get the information that we need. Fake eyelash glue, fake lashes, and using hair glue. Yeah, keyword hair glue on lashes. That no, 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 no. I can't say enough no's. First of all, anytime that we're putting anything on our lid and lash margin, we are potentially disrupting our natural biofilm of bacteria there. And then we're going to already kind of start to affect that natural pattern and growth of the lashes. So if we're going to put anything there, one, we need to make sure that it's designed for the eye, that it's safe for the eye, that the ingredients are good, and that we remove any of the additional debris properly. Okay. So anything that says hair glue, hair means the hair on your head, okay? Not the hair that comes out your lashes. The skin and tissue around the eye, the lashes are very, very sensitive. It's the most sensitive area around the body. So you have to be extra cautious what you would put around your eye, just like you're very extra cautious of what you would put in your mouth. So if you're going to put fake lashes on, one, there are plenty that I prefer better than a strip lash. Okay, yes. Yes, there you go. Yeah. And so I'm just asking, somebody asked about hair glue on your lashes for fake lashes.
Whew.
Yeah, and I was saying, I don't know, there's not even enough no's for me to give. And I was saying that that's a no-no. That's
That's
for
a
the
no, no, no,
hair
no, 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 no,
on
no,
your
no.
head, okay? And when
And
you want to put,
honestly,
go ahead.
I'm sorry to interrupt. And honestly, hair glue is not the best option for your scalp either. Like, I wouldn't recommend it for your hair. If there are other ways of achieving extensions without using hair glue, please do. It clogs pores. It blocks your scalp from breathing. It collects oil and debris underneath the oil, and with prolonged use, it creates parasites at the scalp. So if you start noticing that your hair is weaker over time, weaker through your quick weeks, weaker through your little, let me put a little bang situation, and it's starting to get thinner and thinner and thinner, it is because your hair glue is working against you.
Exactly. So same thing with the lashes, no different. If there are other ways to put lash extensions on, glue is like at the bottom, and you want to make sure that if you're going to use adhesive, that it's designed for the eye. But honestly, I prefer that you either do a lash serum, which we'll talk about, and all these things. What we're hearing is like you want to be guided with a professional. Okay. Another reason why I had hair loss too, going back in college, and not college, but optometry school. When you broke, you be trying to do some stuff, take some shortcuts, and then 6 months later, you're like, what happened to all my long, flowy hair? So the eyelashes is no exception. I always say, if you got a nickel and dime, all right, then you need not do it, all right, because it costs to be the boss, it costs to look good. So if you want to look good, if you want to have these enhancements, then you don't enhance with something that's already less than what you have going on in your body, okay? So if you're gonna enhance, yes, yes, I see the eyes. You need to come to where you already are. Don't go less than what's going on here. Don't go with less than what God
Right.
created to enhance something.
Right.
So if you're gonna do these things, one, you should do the guided and have a professional opinion. And then two, for lashes, I'll say a lash serum. And then what I'm liking now, which I do a lot more often, if I want that volume look, I'll do a magnetic lash. And I do a magnetic lash that's actually designed by an eye surgeon. So she's going to make sure all the products and things that are in there are not going to exacerbate my current dry eye that I have or cause any potential harm. And the last is
Hmm.
moderation. I always tell my patients who want to do these enhancements, don't forget what you look like underneath, because all you're doing is enhancing you. So you can't do it so much that you can't even see your own self without these things that are potentially causing harm for you. So I'm gonna get off my soapbox there. But Dr. Hill Bennett had to clarify. She was like, I'm just asking for the people, but I already know that we don't put any hair glue on my eyes because I'm an eye doctor too. So she sometimes we'll throw questions out there to see, for the peanut gallery, because we probably heard some
And it
things in the exam
happens.
room, that, education is sometimes we just don't know. We hear glue, and when figure out we put it on our head, maybe it's okay for our eyes, but we're saying both glue either way is not the best method.
I'm pretty sure it says doesn't put it don't put it on your eyes on the bottle. So I'm pretty sure that has already happened. But this is not to rag on anybody. Sis just slide the bottle over, act like we're not talking to you. That's not what that's about. We just want to create healthier lifestyle options
Lifestyle.
for you, and that way you got options for your enhancement. Because eventually, like we're saying, with these types of products and lack of technique and application, you're not shortcutting, you're actually extending the
Attending.
process to enhancement. You're actually getting yourself further from the enhancement that you're looking for. So
That's a good
we're
point.
just trying to save you a trip. That's it.
Save your trip and save you so that way your enhancements are actually working. Especially if you're going to invest in enhancing your natural beauty, you want to make
Hmm.
sure that A, you're not doing any harm, and B, that you're going to see the results that you want in the time frame that we expect if you're doing those things properly. So I have a
Yes.
couple other questions that I have for Miss Lexi, and then we'll
Go
kind
for
of
it.
tie hair and further tie hair and loss together.
Okay.
And then if you have questions, continue to put them in the comments. I'm toggling back and forth, and I'll be able to see your comments. And so, what are some things that our audience should do or should consider to reduce the chance of long term hair loss or thinning? Is there anything they can do?
Vitamins.
Vitamins,
Store
okay.
up your body with vitamins. Work out. Get a thorough night's worth of sleep. Go to the doctor and make sure that your hormones are balanced. Make sure that if you're a woman and you're looking to have kids, or that you already have, or whatever place in your life that you're at, that you're aware of what your body is producing hormonally. For guys, work out. Use your testosterone effectively. We don't live in the times where you have to go hunt bears and like wolves and stuff for dinner. So I get using this energy sometimes. It just ain't what it used to be, especially during the pandemic. Get out there and get active. The more you use the testosterone, the more your body will produce healthy versions of it. Because what
Hmm.
happens is, and this is with both genders, testosterone production starts to erode and is replaced with dehydrotestosterone. And dehydrotestosterone is like the bizarro Superman of Superman. It's the one that doesn't have any strength, that can't leap over buildings, that's knocked out with pencils, you know what I mean? Like it's the opposite of what we're trying to do. But the more that complacency happens within your body, it'll continue to grow within your scalp as well. And my last tip is drink plenty of water if you are going to drink dark liquor. All alcohols have different caloric bases and different ways that they affect our blood flow. They affect the quality of our blood flow. They dilute our blood flow. Okay. So if we expect our blood to flow everywhere, okay, we need to stop diluting it so much.
Hmm.
And that goes with alcohol. For all my Henny drinkers, scale back and maybe replace it with a little bit of water and ginger ale sometimes so that we can get
A
we can
good
get some
balance.
internal balance, and that's what I recommend.
And that's interesting to hear. Every time patients are asking me, what can I do? What do you recommend for me to help with my eye health, my lashes, and things like that. And it's always the same thing. We're always saying get a good balanced diet. Make sure you're having supplements if you're not good about getting a good balanced diet,
Yep.
rest, water.
Yep.
And so it's all the same thing. So it's not like we can separate parts of our body. So
Not
whatever
at
is
all.
good for the entire body, all the cells, is going to be good for hair. It's going to be good for eyes. And the way I break it down is like whatever your mama and grandma told you that you need to do, drink your water, go to bed on time, and eat your food.
Yeah,
It's just that simple. It's just that simple.
it can be for
It's
sure.
just that simple. To keep things as to minimize chances. Of course, we can't predict the future, but if we could just do our part and minimize chances, in this case, hair loss and lash loss. So let's talk about. We've already talked about things that we could try to minimize, but what if it's too late? What if we already have hair loss or excessive thinning of hair? And the person is experiencing this and they're coming to you. And because you specialize in trichology and hair loss with your hair clinic, what are options for treatment for these people?
You have a few different treatments. So let's start off from thinning, and I'm noticing a change to, I don't know what to do anymore. So when you start noticing thinning, you got a couple options. You can come into the salon for some of our rejuvenation and repair treatments, where we would go through, do deep conditioning. Let's assess the balance in your hair. Do you have enough protein? Do you have enough moisture? Um, Haircuts, lifestyle services that can help you take better care of your hair throughout the week, such as keratin treatments, which strengthen your hair. That's on a very general, I just want it to be fuller but I have it, right?
Mhm.
And once we start escalating to hair loss, we have a few options. We have the hair HQ hair oils that have active ingredients like saw palmetto, which is, if ingested, is great for prostate health. Saw palmetto is by itself, but the concept of saw palmetto is that it works against the dihydrotestosterone. So the bizarro Superman, this ingredient helps to counteract that effect. So you'll start to notice your scalp will be filling in a little more, your hairline will be thicker, the length of your hair will be thicker almost instantly. Once we start getting into patches, we have a system called Celium Surge. Celium Surge is a black owned, black operated, black manufactured product designed for hair growth on textured hair. Products are super absorbent. Again, they have saw palmetto in them. This is when you want to start switching out the products that you have in your shampoo, your shower, and whatnot. So, better shampoo products, better conditioning products. So, your daily routine now is supporting it. HQ will be coming out with vitamins shortly. I wanted to make sure that the vitamin services that I offered were beneficial without being too aggressive. The reason why we don't hear from Hairfinity and all of those really popular super hair growth vitamins is because they were having extremely adverse effect on the other organs in the body. So you were getting 18 inches of hair in 3 days, but you were wearing out your liver at the same
Oh
time.
yeah.
And you were torturing your kidney at the same time. We don't have to do both. We don't have to do both. So the HQ vitamin system would definitely be scaled back, so we can protect all the organs and give you a thicker, fuller head of hair. We have our laser systems. Um, Low level light therapy is a new way. I mean, it's been on the market, but I'm loving it for textured hair and for the African American community because it is daily treatment. It creates a greenhouse effect at the scalp. So you're able to stimulate the scalp, stimulate the follicle, stimulate the capillary so that they're active and working and wanting to absorb nutrients and oxygen and better blood flow into the hair. And for my wonderful people who are just they're tired of all of the treatments, they have tried laser therapy that isn't working for them. They're more in the alopecia totalis where it's total hair loss, irreversible hair loss. Then we have our replacement options. Some of our options are covered by insurance. So I would love to connect with someone. Let's see if your insurance can cover the cost of your services. I would love to save you money. But we can do daily replacement or we can do temporary replacement. It's all customizable and designed for what's going to bring out the best for you and your lifestyle. So we have a range of ways to address this.
And so I have a question here. Someone asked, how would you treat naturally lighter color hair? So I'm assuming it's a person for a teenager. I guess to
Naturally lighter
clarify,
color.
is this person losing some hair as a teenager, or you just want to know the best way to care for a lighter color hair that is for a teen?
Okay, so if the natural hair color is just naturally light, like if this is an African American teen, we would probably say she has sandy hair or reddish hair or a lighter colored hair, something like that. Honestly, moisture, because it's there's nothing wrong with the color. If it's a natural hair color, it's just the pigment God gave her, and we're all gonna get a different balance of melanin into our hair. Just bear in mind that it's gonna need moisture. A lot of the time with drier looking hair colors, and this is only for lack of a better phrase, is that they may appear drier when really that's just the reflection of the color
Mm.
onto our hair. So maintain it with moisture before we're like, hey, we need to change the color or hey, we need to do something different to it. Just love on it with moisture. And the more moisture you'll see, the cuticles will be tighter and the shinier nature of the hair will come out the more you keep it moisturized with a good moisturizing shampoo, conditioning, and daily treatment.
And so, yeah, she did say it was hair breaks and very dry. So I think you answered her question.
Yes.
Yes, so that's important too. So this is all great information, great information. I want to make sure I'm covering everything. So I had some pre-questions here. And so this is another question because you mentioned insurance and,
Hmm.
helping, your clients to see if you can help save money on some of this treatment. So are these treatments for hair loss done in conjunction with a dermatologist? Is it just a cosmetologist, or is this a collaborative approach to your hair loss and your hair journey?
At HQ, it's a collaborative approach. I am only a paramedical specialist, so I am a part of the medical community, but I am not invasive at all. What I can do with my consultations is scope your scalp, get as close to your scalp as I possibly can. But I'm going to be leaning on their leadership, dermatologists, your primary care physician, the medical industry leaders to provide diagnosis, because when we go to have the insurance conversation, they're going to say, well, where's the diagnosis? Where is this reflected in the medication you're taking? Where is this a medical procedure that was done? How has your body medically been shifted to the point where the solutions that you're coming to me for are the only ones available? So I will absolutely be leaning on the leadership and the referrals of the medical community to make sure that we're operating on the same path, because I would hate to undo any of the wonderful work that they're doing, and I would be remiss if they were overlooking the work that I'm putting in as well.
And so that's another important reason why I have this show, I Spot Talk. And here we mainly talk about the connection between beauty and science with the eyes, but I bring in all different areas of
Hmm.
healthcare to show
Hmm.
that it is a collaborative approach. A lot of times patients will
Absolutely.
come in and clients may come to you. You're like super ultra professional. You're doing these intakes just like we would do. And sometimes clients are like, or patients are like, what does that have to do with my eyes? There's a lot that has to do with the eyes, that have to do with the hair, and we don't
Hmm.
expect for you to know that. We expect you to come to us and let us be the expert to be able to divulge that information and help
Hmm.
you coordinate that collaboration, because sometimes you don't know that other people need to be involved in this process.
Exactly.
And it's people in the medical community, it's people in our hair community, it's people in our beauty community. It's like we all need to work together so that
Hmm.
make sure we're all having these positive and great outcomes for our clients and our patients. And so we're going to
Absolutely.
talk a little bit too, so about, we know that there's a connection between hair loss on your head and direct lash loss that may not be associated with improper use of cosmetics, or improper use of hair extensions and things like that, and some specific conditions we're going to talk about, because we may have some listeners who suffer from these conditions or know family members that do, to
Okay.
recognize that there may be things that we can't do with these conditions. Specifically, if you have any autoimmune conditions, a lot of times when you have an autoimmune, that means that your body is not accepting of itself. It's attacking itself from the inside,
Yeah.
and it usually causes a lot of changes in the body overall. And the eye is no exception. A lot
Hmm.
of autoimmune conditions, a big one being a thyroid condition,
Hmm.
can cause some hair loss, hair growth. It can also exacerbate your chances of dry eye or ocular surface disease. And so when people have autoimmune conditions, I know when patients, I'm treating them for ocular aesthetics, ocular surface disease, a lot of those things, they won't have a cure or come to a place where things are just 100% better, but it's still important for them to be managed. So when these patients are getting these diagnoses, at what point along that journey should they see you, when they experience issues, or to come in when they're first diagnosed, and make sure they have somebody helping with them to care for their hair, not only doing things at home on their own?
I recommend contacting HQ when you're having a good hair day. I'm gonna be
Mm-hmm.
honest. But the minute your lifestyle doesn't support your hair growth, and the minute you're noticing handfuls of hair loss from daily brushing, or you're noticing clumps in the shampoo bowl or in your shower, you're gonna lose 80 to 100 strands of hair every day. So it's going, and that's throughout the whole 24 hours. If you're seeing that in one setting, call me,
Yeah.
because it my job is to figure out, is this an internal issue or is this an external issue? A lot of people are experiencing hair loss from mechanical issues, bad shampooing and conditioning, poor maintenance, poor blow drying, poor equipment, cheap equipment, um, poor wrapping habits and overnight maintenance, things like that. Again, excessive protective styles. So, my job is to assess, like, where are we at? Is this something that's from her medication, where it's something that none that my external products won't be able to remedy, or are we getting below the surface? Once we're below the surface, that's when we need to switch over, because it may be an issue of blood work that needs to be done, where we can get conclusive results on where your levels are, maybe even bring to light medical things that you weren't aware of. things like that. I have the ability to tell my clients when they're pregnant. I know when your hormones are changing in your body. Your hair is the tattletale on your body. So it really is. So allowing me to really have a thorough consultation sets the direction of what we should do with our path.
I like what you said. Come in when you're having a good hair day. Same with eye care. Don't wait till there's a
Hmm.
problem. Come in when you're seeing great and you think
Hmm.
everything is well. So that way we
Hmm.
can screen and then to have a good baseline to compare to say,
Hmm.
yes, I saw you on this fabulous hair day or this fabulous eye report. So what happened 2 years later?
Yep.
Don't wait till things are bad. So I really like what you said there. Come in when you have a good hair day and come in when you're seeing well and you're not having a problem. So that way we can get that baseline information. So
Hmm.
autoimmune alopecia are some cases where you're probably going to see some hair loss on the hair, on the head, the eye, the brows, as well as with chemo and chemo and radiation. We experience that a lot regularly. For listeners who are joining in and may or may not know, I'm experiencing that now, not myself personally, but my mom is going through that. And so a lot of the things that we have on here, I'm always asking, as a chemo patient, what should she know? What should she
Hmm.
do? How should she prepare for when her hair starts to regrow back?
Hmm.
So I'll talk about what we can do on the eye side. On the eye side, when we know we're going to chemo, just like or radiation, or other issues that may affect what we call the oil glands. If there's any damage or degeneration to those glands, it's going to be very hard for your eyes to stay hydrated. And then as everything starts to regenerate and grow back, the lashes usually come back, but there's things that we could do to help kind of speed that up, make them a little bit more thick and luscious. And those are going to be with some lash serums. There are only a couple serums on the market that actually help to grow your lashes. Well, actually, one that's FDA approved, and that's Latisse. It is a derivative of a topical medication that we use to treat glaucoma. So it's one of the side effects. So patients that were being treated for glaucoma were getting these lovely lashes, and it would change some people's eye color. And so,
Oh.
the particular company was smart enough to say, well, let's repurpose this and make it an enhancement. So an enhancement, but then for those communities where they're suffering from autoimmune conditions, chemo, radiation, things that are making their lashes not grow and healthy, and we can help kind of speed up or enhance that process. And then there are some that are more like conditioners. But if you are getting ready to start a chemo or radiation program, I have patients come see me first. So one, we can look at those oil glands, see what we're working with, and then we'll talk about how we can maintain the oil glands during the process. And a lot of it is just holistic things that you can do easily at home and in the hospital. My mother was doing that, these things that I recommended in the hospital, doing her treatment. And then post treatment, and once everything's cleared, then we'll talk about what we can do to get those lashes and things to grow back with different serums. So far as hair growth, that journey to get things back, what do you recommend for those patients who are just finishing or getting to go through chemo and radiation?
The first thing I recommend, I worked with the Look Good Feel Better program with the American Cancer Society for about 5 years. I'm super passionate about this. The first thing I recommend is get prepared. So make sure that you have, because the thing is this, you will have an exposed scalp if you do lose your hair. So the most important thing is sunscreen, scalp moisturizer. I recommend HQ hair oils, obviously, and that you have protective coverings. So if you want to do wigs and weaves, make sure that they're lined with like a silk cape, like a silk scarf, or if you want to wear caps and whatnot, make sure that they're lined with satin, things that aren't going to create friction at the scalp as it grows back. Um, there is not a lot of things that can be done until the hair starts growing back. The cool thing about chemo is that as the chemo is leaving your body, as the treatments and whatnot are over, your body is going to be excited to produce hair. So I want you to get excited about it as well because that's going to encourage the process. Definitely, as soon as you're able to take vitamins, definitely jump on a vitamin routine. And that way, we know that your body is functioning how it should be to stay in remission, as well as that your hair is getting the nutrients that it needs just so that it grows. Because a lot of times it may need extra vitamin D, extra iron, extra zinc. I would even offer magnesium. Those are going to be your top four to making sure that everything stays on the up and up. You can typically find those in a multivitamin. And just be patient with the process. Your hair, on average, is going to grow about a half an inch each month.
Hmm.
That's And that's on average. You may have exponential growth if you do keep it moisturized. If you don't, please be patient and excited that it still will. Because it's a process, and the journey to healing with your body physically will also be reflected in your hair. So be very patient, stay hydrated, stay moisturized, stay vitamined up, and and love on yourself through the journey. That's my recommendation.
And someone asked about biotin. So we said zinc. What about biotin?
Biotin is awesome. I love biotin. Um, just make sure, like I said, you want to stay away from things like hair affinity, things that are promising exponential growth, because, like I said, they're going to have that exponential work on your other organs as well. But biotin is good, vitamin D is good, iron is good, zinc is good, magnesium is good. Those are going to be a good top five for you.
Okay, good. So I hope that answers the questions, and I put those in here. So iron, zinc, magnesium, biotin, those things are good, and just stay moisturized. So a
Oh,
couple of
yes.
things before we conclude. These
Yes.
oils, girl, you got me. I'm gonna need to re up when I come in this week. But where can my people get these oils? These
At
oils, y'all. This peppermint
HQ.
oil.
Listen, so I just colored my hair last week, y'all, right? And sometimes when we color our hair, our scalp can be dry, especially with as platinum as my hair is. And I put some of my own oils on my scalp. I was like, this is what they talking about. I hear you. I hear you guys.
My kids asking me, "Where's that oil?" My scalp is dry, because they're heavily in sports, and so they're washing their hair. And you got my son
Mhm.
asking for that peppermint. It was like, what was it? Peppermint and
And
cedarwood,
cypress, no, and cypress.
cypress, girl. And we
Yes.
massage that in there, and my little 11-year old be like this. I was
Mhm.
like, I'm creating some monsters between their warm compresses for their meibomian glands and this oil. Their spouses when they get older,
You're
they
gonna
don't know how
have
to
some
deal with them.
supple kids, honey. Them kids gonna be supple and moisturized. I love it.
From the crown
Yes,
to
you
the bottom. But yeah, so
listen.
go to HQ. What? So tell my
Hair
listeners.
Okay, so I have three different options, right? So the first one is the cedarwood and rosemary. That has saw palmetto in it. That's your hair food. Hair is gonna grow instantly. I promise you. The next one is the peppermint and cypress that she's telling you about. And when I tell you instant scalp relief, instant itch away, instant nourishment for psoriasis, eczema, dandruff, all of that stuff to make you go like this, perfect. I even recommend it for my clients between their extensions and their wefts. We can still moisturize our scalps. And then for my stylers, for my other cosmetologists, for my people who do their hair at home, I have the Citrus Blow Dry series. And that is a serum and a spray that work as thermal protectants for the hair, including all of the hair food ingredients like rice bran oil and almond oil and jojoba oil to keep your hair super moisturized and healthy while we're styling it with heated tools. So you got a couple options. Check them all out at hqhairclinic.com. And I would love, I even have these cute little mini cedarwood ones that have a roll cap on them. And that way, if we really, we don't have time, but we want to take care of our edges, roll it right on the scalp,
Okay.
baby. Roll it right on. So,
So that's hqhairclinic.com.
yes, ma'am.
Yes. Okay. And then she has her Instagram handle on here as well. Let me
Hmm.
see. Where did it go? Let me see. So I
It
can
should
put
be by
some.
my name.
I don't know. Something happened. Let's see if I can add it back here. Hmm. Your name was there. Both of our names went away. So I don't know what I did, but that's when when it's time to go. When technical difficulties you can't even explain,
It's all
because that's
good.
how you know you've been on
It's
here
all
too
good.
long. But yeah, this is some fabulous information. So you need to follow Lexi on Instagram or go to hqhairclinic.com. If
Please.
you're experiencing some lash loss, some lash thinning, one, let's stop putting any external factors on there first. Come on in and schedule an eyelid consultation. And last time I'm going to automatically screen you for ocular surface disease and dry eye disease. Basically, we're going to make sure that the bacterial level is balanced. We're going to look at your oil glands. And if we need to clean up that surface a lot of times and to give you recommendations on the proper cosmetics that you should be using. So look out. Eyes Are the Story will be in our office this month. It is a
Hmm.
cosmetic line developed and inspired by eye care professionals, and
So
it is
proud.
mascara and liner, and then also we're going to have cosmetics. We'll talk about it. We'll have the esthetician on here again sometime next year. The things that not cosmetics, but aesthetic and facial cleansers, things that you wash your face with. Those chemicals in there can cause dry eye, blepharitis, issues around the eye, and exacerbate dry eye disease. So we're going to talk about ways to clean our faces, prevent or enhance anti-aging, but not cause any other issues. And that will be in our office either by end of December, beginning of January. It's called Oculaire. So I'm so excited about that. So this
Yeah,
is some
too.
valuable information. Let me just make sure I didn't miss all the comments here. Someone said, how soon would you notice a difference when you start using these oils?
So with the cedarwood and rosemary, I started using one on my client at the beginning of August. And it's what, December now. Her hairline has started filling in probably around the beginning of October. It all depends on your starting point.
Mm-hmm.
So if you have a dramatic starting point, be patient with it. I always recommend at least 90 days to start seeing it. That way the cycle of growth can be regenerated. Um, but results are going to vary. I had a client take her unit off the other day, and while I was preparing her extensions for, she started screaming from the other room. She was like, "Girl, my edges is back," and they and she was like, "I don't even want the weave." I was like, "No, we don't weave today." But come on, that's what's booked. But her hairline was growing beautifully. So results are going to vary, but they're going to happen.
Yes, and so remember your oils. You want to make sure you're externally, but internally as well. You make sure you have your
Mm-hmm.
supplements that we talked about. Make sure you're getting enough rest, that you're staying
Mm-hmm.
active, you're managing your
Sleep.
stress levels. And then any lash serum, if you use lash serums to help growth, we recommend about 4 to 6 weeks to begin to see changes. But definitely that start at 10 to 12 week out is when you're going to start to really see the benefits of your commitment. So everything is at a commitment level. So you got to
Yes.
make sure that you're doing things regularly to get those outcomes that you want. But yes, and individuals maybe want to ask you some additional questions to book an appointment.
Please.
Where can they
Please.
find you?
Also at hqhairclinic.com.
So
Just go to the website. You can submit questions directly to the website, or you can schedule a virtual consultation or a hair loss consultation online as well.
awesome. So Alexi, as I call her, it was very tough for me to say Alexis. So
I know, right?
Alexi,
Yes.
thank you for joining me today. She is a
Thank
wealth of
you.
knowledge. She has been a part of my hair care journey for almost just under a decade. So we use
7
Kennedy as a
years for
reference. Yeah,
sure.
we use her
Yes,
as a reference. And so wealth of knowledge. And if you're looking for someone who in the Atlanta area not only cares about your hair, but cares about you as a person, then you need to go see Lexi. All right. And she's going to help you through your hair loss journey. And so thank you for tuning in. We're here on Sundays, the first to the third Sundays. This is iSpa Talk, where we help you connect the dots between beauty and science. You guys have a
Five
great
beautiful
evening and thank you
people.
for joining us.
Thank you,
Bye.
Dr. Janelle.
You're welcome. Enjoy the rest of your evening.
Likewise.